That's why for pregnancy, it's a TikTok. It's time. So doctors don't advise when you're in mid-40s, we don't advise already to get pregnant because the quality of egg is not good. You can have a lot of complications during pregnancy.
Assalamualaikum. What's up, everybody? I'm Mimifly, and welcome to Tentang is Good podcast, where we talk about mental health issues, womanhood, mental health challenges, and how to be calm. Brought to you by Be Calm. This thing right here. Thanks, the big part to Be Calm. And today we are going to talk about period and menopause. Okay, so we go through it every month. We are affected by it every month. And as we get older, we enter menopause. So what do we need to know about the cycle of being a woman? We're going to talk about it today with my guest. We have Dr. Anuradha, consultant obstetrician. Did I pronounce it right?
Yes.
And gynecologist from Hospital Tengku Ampuan Rahimah, Klang, and Beacon Hospital. And we have Kamalia, Azna, flight attendant, insurance agent, dancer, mother, and a friend of mine. Well, actually, I met Cam because she keeps coming to my dance class. So that's when we become good friends. And thank you for coming. Welcome. How are you guys doing?
I'm good. Thanks,
Yeah?
baby.
Okay. We are go. Thank you. Thank you for sharing your energy with me. Let's just dive into it. Okay. So I really want to know, right? How does the menstrual cycle impact mental health, doctor?
So to understand how it affects, we have to understand how our menstrual cycle is. Kita punya kitaran head, isn't it? So kita punya kitaran head is always have fluctuation of hormones. Okay, in our cycle. It can be 28-day cycle, can be 30-day cycle. Tapi selalu ada fluctuation of hormone. Okay, so in one cycle, you will have your menstruation, is your period. Lepas tu, you will have a peak of hormone estrogen. Okay, the graph will go up. There's a peak of estrogen. Lepas tu, ovulasi akan berlaku, ovulation. After that, is a peak of hormone estrogen pula. Okay, so if you
there's
don't...
this fluctuation of hormones going on.
Yes. In one cycle itself, okay?
In a month,
okay? So if by third week, fertilization, that means pregnancy tak jadi, then the estrogen and progesterone will come down, okay? Then only end up period again. So bila the estrogen and progesterone come down, that's when lot of physical changes, emotional changes the woman go through. The week before the period.
how does your period affect you, Cam? Because let me tell you, I am extremely affected by my period. The thing is, we talk about this all the time, and sometimes, Ken, why do we have period at the same time? Why do you have friends like? Does that have like medical term, doctor? For when you and your friends having period at the same time.
Tak ada.
How does it affect you? Like mentally, Cam, how does it affect you?
I think I'm having the longest period ever, doctor. Like more than 14 days every month.
40 days.
14.
Oh, the flow.
14
the
days.
flow, every month. Because I've been to the gynae when I was younger, since I was 13. So the gynae said, it is normal for me.
So because it has been like that.
Yeah.
Ah.
So okay, and it's very tiring for me. It's very tiring for me, and the hormone changes, your physical, your mood swing.
Oh my God. It does impact me too. Yeah. Like, but it's not 14 days, but it does impact me too. But is it like true? Because I have my mood swings is crazy, but it's happening inside. Of course, because in my line of work, I kena macam control, right? Right, dia kena control. But man, oh man, how I wish kalau first day, second day period, I'm not working. Kan? So what are some common emotional challenges women may experience during different phases, doctor?
Okay, so that's why we women go through so many different phases. From first time getting period, puberty, so you go through a lot of changes in your body. Then you start having menstrual cycle, and different women, different cycle, different symptoms. So when I said the week before the period, di mana the estrogen and progesterone comes down, PMS, premenstrual syndrome. It is real. Okay, it is real, and different women, it affects different women differently. So that's when they get physical changes macam breast tenderness, bloating, boleh ada constipation or diarrhea. Some will have mood swings, food cravings, crying spells. All that happens a week before the period and only will relieve few days lepas period, the symptoms. So different women, different symptoms. So it's different. So it depends how teruk is your mood swings. So if you can cope with it, then you will be fine. Tapi memang as I said, different phases. So menstrual cycle, lepas bersalin, after post pregnancy also your hormone estrogen progesterone is low, very low that time during your confinement tu. Sebab hormon lain tinggi, oxytocin dan prolactin. Sebab masa tu nak kecupkan rahim untuk breastfeeding, hormon tu pula tinggi. So that's the time also woman actually boleh experience low mood swings, feeling low. Actually many women don't share all this actually.
Do you want to share the challenges during different phases for you? Let me just share with me, like 1 whole month, how does it go for you?
Macam you jugalah. I pun macam first day, second day period MC. Tak pergi kerja. Sorry boss.
Don't tell Cam's boss.
And then because memang you have a stomach cramp and then your mood swing. Sometimes I punya cramp tu doktor, I pernah masuk hospital, I pernah faint because of that cramp. That intense kan. So macam mana I nak go for flight? You need to take care of the passenger, the safety and all. So might as well I just call for sick lah.
But with me kan, dia macam maybe 1 week before my period started, I will start craving food. I start to be like, everything becomes emotional for me.
Everything sedap.
And then I don't think about sedap. I feel like, if I want to be honest, it's not really about whether the food is good. I just makan because I want to makan. And I can't explain it. Dia just rasa macam nak makan. And the food yang I makan tu lewat malam. It's like bila datang malam tu macam masa tu lah dia rasa macam nak makan. And then the cramp. Oh my God. Yeah, until now I have that cramp. Tapi that cramp only happen macam during day 1 or day 2, where they feel this macam memulas ni, and they will just hold on to me for 3 minutes at least, kan? I pernah ada this one time kan guys. I was in a meeting tau. This meeting ni I kena present, okay? And I tengah present dekat depan meeting ni lah, macam meja, and then people were just always talking about apa, I forgot lah, there's this proposal I need to present, and I was having my period. I told my brother masa ni, like maybe you should handle this talk because I am on my day 1 period ni. So macam it's okay, we can do this. The moment I start talking, and then the cramp datang, zup, macam tu tau. And I tengah cakap ni terus macam it's really like pulas. Dia macam pulas yang lama tu tau. Yang ni kalau macam dekat rumah, if I'm not working, I will be in bed yang guling until it's released. Sometimes macam my friends also taught me macam do some, what do you call that, macam hinge movement lah for my hip ke apa ke. But it I guess I have to do it every month because dia punya intensity tu memang I guess different
Yeah, different individual, different. So, of course, PMS is one issue. Another issue, some people can have heavy periods. Period and very heavy. I have patients tukar pad setiap 2-3 jam kena tukar pad. Blood clots, huge blood clots coming out. Sampai kena tembus baju. So, it's affecting their quality of life. Senggugut yang sangat kuat sampai tak boleh bangun dari katil. Cannot get out from the bed. Need very strong painkillers. Need to go get injection. Need to take MC. All this is what some women goes through.
The way you say it, as if what I've gone through is not as bad. There are worse.
Yes, there are worse.
Wow. So sampai kena ambil painkiller.
Yeah, they have to go to clinic to get an injection. Then only they can get up from the bed.
What injection is that?
Painkillers, strong painkillers.
Strong painkillers.
Yes.
Injected.
Yes. These are the different things that they go through, but they don't have to suffer actually if they go in. If it's affecting the quality of life, you should see your doctor.
Right. Say it again, doctor, to the camera. Say it
Which
again
camera?
to the camera. You can talk to this camera. Say it again.
So if it's affecting your quality of life, please see a doctor.
Right. And you can see Dr. Anu dekat Hospital Tunku Ampuan Rahimah, also dekat Beacon Hospital. Yeah. So, okay, let's talk about some effective coping strategies for managing mood swings and emotional fluctuation. Because to me, that's something that I need to work on, because I am always with people where I need to be in service to others. And I feel like people like me, especially like doing the in-service business, it affects me because sometimes I cannot think straight when I'm having my period. So can you share with us?
Sure. So firstly, it starts with lifestyle changes. Okay. So studies have shown regular exercise, regular physical activity can reduce all the symptoms. Okay, I'm not talking about nak pergi gym ke apa, tak semestinya. Anything moderate physical activity, can be a fast walking, boleh swimming, Zumba,
Dancing.
Yes, all that regularly.
Shopping is walking.
Yes, walk fast lah.
Yeah, walk fast.
So all this, if you do regularly, at least 20 to 30 minutes per week regularly, it can alleviate some of your symptoms. Of course, number 2 is a balanced diet. Okay, why? We women, we need certain nutrients and vitamins actually. So that's why we need a balanced diet. Fruits, vegetables, unprocessed food. If you are taking balanced diet every day, almost every day, you tak sebenarnya perlu any supplement. So the advice is to take balanced diet. It involves vegetables. You must have at least minimum 1 or 2 vegetables variety, more green leafy vegetables, and high protein, proteins, chicken, fish, egg, or if you're vegetarian, tofu, tempeh, things like that.
And chocolate?
Chocolate during your PMS time,
It's
small
perfect,
amount,
ain't it?
Can.
It's perfect.
But the only thing is, chocolate, small amount can. So because why? All this processed junk food, actually we call it inflammatory food, yang menyebabkan radang dalam badan.
Right. And that is not good.
Yeah.
And that is causing the bloat ke or no?
It can cause all
More
more hormonal imbalance. So because we need nuts, we need variety of food. So, and the other thing is, if you're not taking balanced diet, you may need to take supplement macam calcium, magnesium, vitamin B, because this have relation with the brain neurofunction and all that.
Ingat tu guys, calcium, magnesium and vitamin B.
So if you can Google lah apa food with high calcium, magnesium and all that, then you include in your diet lah every day.
How about you, Cam? How do you cope? Your coping strategies, please share with me.
Okay, I have this, what you call that, the schedule of the period, because apps through the menstrual calendar. Okay, so I can like spot when I'm going to have the period. So the first person I'm going to warn is my husband. Betul tak? The closest person kan?
Good to know you have a good support system, Bu.
Jangan cari pasal nak period lagi seminggu.
A good one.
So every month your husband would know.
Basuh pinggan, makan basuh pinggan. Time tu dia pandai basuh pinggan.
Very supportive husband.
If not, you know, things in marriage, you need this thing. You need
You
this.
need to communicate.
Yes, you need to communicate. Whatever it is, you need to communicate. Because if not, because of one small petty things, dia akan jadi like boom like that, Gaduh macam benda yang kecil je macam.
Can you share how do you communicate that to your husband? Like, I'm your husband now, tell me.
Sayang, nak period ni sayang.
That's
As simple as that,
Okay.
Use that, okay? Use that.
Right. I would definitely use it. My coping strategies involve isolation.
Actually, isolation is part of the emotional issues that we go
Right. Because
through.
I don't want to give I don't want to deny that I have this pain happening at this moment. I don't want to deny it. So because I tried hiding it, I tried to just be okay, but I think it's detrimental to my mental health. Like, betul rasa macam
Social
torture.
Social isolation is all part of the woman that goes through.
Right. I really like macam I'm not going to apologize for it yang macam tu tau, because I feel like I need to rest, and this is the day when I feel like if I'm not working, I'll be at home, hot tea, macam pamper lah, lavender tea kononnya, and I watch movies, I move a little, just for supaya, because I feel that is true. When I exercise or move my body, the cramp is not so bad. The cramp actually reduce to significant amount. Dia tak stress sangat. Kalau macam I completely baring je and ralit kan, and just hayal je, so tak buat apa-apa, then I will feel the cramp. Lagi sakit, lagi banyak kali cramp tu. And kalau so I decided to just move a little here and there, but then most of the time I rest. I really I cannot talk to people so much.
I want to add in the coping. So if you have cramps, you can put a hot bag.
Like a hot pack.
Yeah, hot pack yang masa demam, the bag besar tu. Yeah, hot pack. The studies have shown it reduce the cramps. Yeah, put a hot pack depan ke belakang ke, whichever pain where you're experiencing pain, you can place the hot bag.
Doctor, can you explain to me, when we cramp though, what's happening?
I think because
what's happening
inside.
Is it a muscle?
Okay.
Is it muscle? Is it the ovary? What's going on?
Okay. So rahim kita ni ada 3 layer sebenarnya. Outside, and then the muscle, and then the inner layer. Okay. We call it dinding rahim, or lining of the uterus. Okay. So the lining of the uterus yang change during the menstrual cycle. Dia jadi tebal, nipis. So during the estrogen tinggi tu, your dinding rahim tebal. It repairs. Lepas period kan, it repairs, jadi tebal. Then dia tunggulah pregnancy occur. Dia dah ready untuk implantation, tapi pregnancy tak occur. So yang dinding rahim yang tebal tu kena shade now. Shade out as period. Basically your rahim tu tengah kecut untuk shade out the wall lah, lining of the wall.
Basically, instead of having a baby, dia ada blood and tak ada jadi baby, dia keluar, doktor.
Dia keluar. So dia prepare untuk baby nak melekat kat situ. So pregnancy doesn't occur. So the tick that it has been preparing for weeks, now it has to keluar lah, shade out. That's why the fungsi rahim ni untuk mengandung sahaja. No other function.
Doctor, I have one question, doctor. Sorry. Okay. Like we are getting the period like every month, like throughout the years, but still we cannot get used to the pain. Why?
Right. The thing is, some people have mild pain, which they can cope, okay, with their daily activities. That's the thing. If you cannot do your daily activities, you don't have to suffer. Go see your doctor. The most important thing is, this is a natural process, betul tak? All this natural process affects different women differently. Okay, so if you cannot do your daily activities affecting your quality of life, then go see a doctor, then they can help you.
And also macam, especially if the ones yang suffer emotionally, something that you don't see kan, you don't get to experience physical pain ke apa ke, but this is like more about emotional. Can they go see their doctor?
Yes, as well. That's why I want to add another coping strategies that relaxation technique is also very important. Yoga, meditation, breathing, even spa, massage, all that also will help to cope all these emotional challenges. And also plenty of good sleep. Good sleep is very important. Must be persistent, right? Yeah. And reducing your caffeine intake, alcohol, all that will help too.
Like this.
Yeah. Anything
Can
that
this be a coping?
Yes, anything that can make you calm.
Right. Okay, so remember, guys, it's about enough sleep. Although sometimes we cannot sleep because of the period cramp. Try to sleep. Okay, now we want to talk about menopause. What is the age again? What is the average age for a woman to hit menopause?
Okay, average age is 51, 52, but the process of menopause can occur from the age range 45 to 55. It can happen. Sometimes it depends on your genetic. You menopause at what age,
Is it scary?
It is scary for most women, okay? Because we go through again a lot of changes, physically, emotionally, a lot of changes because yang menstrual cycle tu estrogen jadi low tu temporary saja, betul tak? Just for that week and then it goes up again. But menopause means it's the end of your menstrual cycle. Okay, dah habis. Your kitaran haid dah habis. So usually a woman who don't have period for 1 year, we already confirm the diagnosis, your menopause. Tapi some women experience changes before the real menopause. Kita panggil perimenopause phase.
That one is the scary part lah. I mean, entering that phase must be scary. Not only it affects women who still want to have babies, right? In those time, like I feel like in their 40s they want to have babies. I think emotionally we are challenged when we're getting
Perimenopause.
perimenopause.
That's why for pregnancy is a TikTok. It's time. So doctors don't advise when you're in mid-40s, we don't advise already to get pregnant because the quality of egg is not good. You can have a lot of complications during pregnancy. So time is a factor for
That's
women.
why it gives so much stress.
Stress. Betul, a lot of pressure.
Because time is ticking.
Yes, true.
You are in your 40s, Cam. Do you feel like different having period or like entering period in your 40s? Is it different? Is it?
My period during my younger time, the period was a lot. The quantities, a lot, but it's become lesser now. So,
Well, yeah, I remember like my period used to be like 8 days back then. Now it's just 4 or 5 days. That is short.
But it's still normal.
It's still normal, right?
As
Yeah.
long as it's not very heavy, abnormal, irregular bleeding,
The
that is all
cycle-
not normal.
Right. My cycle is a bit short though. I think it's like 22, 23 days.
Yeah, up to
So
some women have 21 days.
Right. Because there were times when I had my period twice a month. Like first week and then end of week, I get another one. That's normal, right?
Yeah, that's normal.
Woohoo.
But I want to add about the menopause. Menopause changes, I did not say that. When you menopause, that means your estrogen is completely gone. That means very low in your badan, blood circulation. So a lot of physical changes that happens is you can easily put on weight, then sakit lutut, sakit sendi, sakit badan, all that happens. And then of course you can get hot flushes.
These hot flushes is famous. I heard this from many of my sisters out there. These hot flushes,
It can be sometimes very, very uncomfortable for certain women. Hot flushes, night sweats, even though in aircon they're profusely sweating.
so it's like heat. Is it like
Yes.
panas?
Yes, betul. Betul.
Wow.
Yeah. And
Within.
also mood swings. They have go through a lot of mood swings, susah nak tidur, lack of sleep. They go through a lot. And different women go through their menopause differently. Some women symptom dia kurang, can cope, nothing for them. Some women suffer, like tak boleh tahan, and then it lasts long pula. Some women short experience, some women long the symptoms.
Wow.
How to prepare, doctor, for that?
So as I said, if it affects you, you see, we women now, we go out, we do a lot of activities outside. Not like last time, So last time, I don't know, my grandmother even, my mother, I gave a hormone lah. So I don't know how my grandmother last time all could cope, Yeah. So now women can voice out lah. If it affects their quality of life, you cannot buat kerja macam biasa outside, then you can seek medical treatment, yeah.
Can you share how hormone treatment affect mental health during period and menopause?
So during the period, like if those who go through PMS and menopause, if it affects them, then they can take hormone treatment, okay? If they have period problems, macam PMS or heavy period or severe pain, we can give hormone treatment. As I said before, the problem with menstrual cycle, our normal menstrual cycle is kita ada fluctuation of hormone, betul tak? Up, down, up, down. So if we give a hormone treatment for those who have problems like PMS ke, heavy period ke, or painful period, what it'll cause is the hormone is just sustained. So there's no up, down peak of the hormones. So it'll just sustain, so it alleviates all your symptoms that causing problem for you. That is for periods. For menopause, it's actually called hormone replacement therapy. We are replacing a hormone because you are already lacking in that hormone. So we replace the hormone too.
So, meaning your mental health will just get better once you get this hormone treatment?
Definitely. If it's affecting you, then you seek medical treatment, and the treatment can help you.
This really happened, right? Like, it does cause depression and anxiety and like period and menopause, actually.
Yeah, betul. Because when the problem is when the woman can't cope, keeping inside, cannot cope, not sharing, not talking to family or friends, don't know how to cope, keeping it inside. Sometimes menopause ni, they can get confused juga, menopause with are you having some mental health issue? Because the menopause woman can have really bad mood swings.
Right. Yeah. So, how do we know? How do we know that we are actually going through menopause, or it's actually a very serious mental health condition?
True. It's better to seek a doctor, but what you have to look out for is if you have low interest in everything, in your usual activity. Katakanlah you suka gardening every day. Now you don't want to do gardening at all. You don't want to do your usual activities. You show very low interest in the things that you used to like. That is a sign that it's something serious going on. You're out of control. You cannot focus. You cannot concentrate. You cannot make decision. Lack of energy and all that. So that could be something you're dealing with, something more serious.
I see.
Wow, guys. Just
Panas.
tiba-tiba I got hot flashes. belum menopause lagi.
Doctor, last time, I ingat kan macam like we are having PMS, and then versus the menopause. So I was like, okay lah, dah menopause nanti dah tak ada PMS, dah tak ada mood swing, dah tak moody. I was like, okay, it should be better. But it's not actually.
No, actually. So that's why some women tak ada symptom pun menopause tu. So it depends on individual what they go through the symptoms.
You know what you're
sebenarnya.
talking about menopause ni? I remember this phase where my mom, she wasn't nice. She wasn't nice at all for months. And I think now I'm starting to feel like she was probably having her menopause symptoms. And I guess, this is just for us to be kind, because women go through this inside and we don't talk about it enough. Right? It has always been, people always like macam look at period dengan menopause ni macam darah kotor, tak boleh solat. It's like macam very like, how do you call that? Period and menopause ni got bad raps lah. Dia macam dia bad raps lah. But it does affect women tremendously, and it affects the whole relationship surrounding us, and it's important to be kind, guys.
Be kind, and I said you don't have to suffer alone for women who are going through severe symptoms in menopause, because when you menopause it also causes vaginal dryness, no interest in sex, that can affect your relationship with husband. So you don't have to suffer. You come and seek medical treatment.
Wow. Intense. Thank you so much, Doctor. I have one last question for you. Can you provide an insight on the importance of mental health discussions surrounding women's reproductive health, and the steps we can take to, promote change?
So as I said, memang mental health ni affects more women actually than men. You know why? Because now of the hormone fluctuation. Because why? Kita punya estrogen ada berkait rapat dengan kita punya happy mood brain chemicals. Sebenarnya, there's a happy hormone in the brain, and the estrogen goes hand in hand. So when your estrogen is low, your happy hormone is also low, it can affect you. So that's why mental health affects more women compared to men. And we go through a lot of different phases.
And every month.
Yeah.
It's like week by week.
Without miss.
Without miss. That's why people call us crazy.
You see, that's why, Mimi, labeling like this, the one, makes women don't want to come out. Labeling like this. So the woman, if they have issues, mental health issues, they don't want to come out bersuara because they takut you label as, oh, you're weak. You ni tak kuat, you crazy, you're dangerous.
They don't believe a word they say, ladies. Do not believe a word they say. You are just having your period.
So labeling, stereotypes, stigma, social stigma, also causing them don't want to come out to share what they're going through. You must remember, if you don't take care of your mental health, it can become a mental disorder, a disease.
Right. And it's also because we don't talk about it, but we talk about it in our head. We talk about it in our head. And I feel like women, if we don't talk about it, we don't want to talk about it. The thing is, how we talk about it in our head matters, because this one can cause us to have mental health issues ni, where we start shaming ourselves for having this feeling. We shame ourselves for being a little intense at times, and we do this to ourselves without realizing that it's actually our body is going through hormonal changes. And this is why we picked this topic, so that we can talk about it, so we can clear out certain things that we find confusing every month. Rather than just move on with our life, at least now we have some insight.
I think your tips of being isolated every month is good. Safe.
If you have the luxury to just spend time with yourself during your first 2 days of your period, then you're a lucky girl. Like I'm lucky because I can do that sometimes. But this we don't get to do that all the time. And
especially
some women out there, some women out there, you guys tak ada pun time for that.
Yeah. For me, homemaker or housewife, they are more busy than they have no rest at all at home.
Okay, so we are ending this podcast today. Thank you so much, Dr. Anuradha.
Thank you.
Thank you so much, Cam, for sharing your insightful, very informative. Thank you so much. And to all the ladies out there, period and menopause is something that we go through every month, and it's something that we need to know. So thank you for being with us until now. And I hope to see you guys again next episode, Tenang is Good podcast. See you.